Good morning, everybody. Actually, good afternoon. I apologize. Welcome to another in our educational series of webinars we're calling NTSU or NTS University. My name is Eric Malice. I am the Chief Product Officer as well as the co-founder here at National Test Systems. I have about 20 years in the business, and ever since I got into this, my primary focus has always been understanding the science behind this. It's fascinated me to no end, and I've done nothing but read as much as I can get my hands on to try and get a really good understanding of all things clinical toxicology, but really especially as it relates to what we're doing here, to drug testing. Today we have another, like I said, another on our ongoing series of educational webinars. We bring these to you really in hopes of enlightening you. I think education is very important. Of course, it was something that I really enjoyed. So, of course, if I like it, you should like it too. That's just the way I am. But no, we feel it is very important for you to have as much information about the drugs and the drug testing as possible. More than anything, it's going to make your daily drug testing duties a little bit easier, or at least a little bit more insightful. So we've got about a 15, 20-minute presentation this morning, or this afternoon. I'll get that right at some point. After which you'll be able to take questions and answer your questions. You'll see on the left panel of your screen, there's a button there for questions. You can go ahead and enter your questions at any time during the presentation. Just know we'll be waiting until the end until I start answering them, so keep that in mind. Again, we don't charge you for these things. There's no hidden fees or anything like that. We just really think that these are important. We really think the information we're presenting is helpful. And we think, again, it's going to make your daily drug testing duties at least a little bit more insightful. If for some reason we don't get to all your questions this afternoon, just know that your consultant will be reaching back out in the next couple of days, at which point they'll get your missed question. They're also going to take suggestions from you for topics of future webinars, or even one-on-one or direct training for you and your staff, either on this subject or another subject that you find would be helpful. In fact, this topic today came off a suggestion from somebody at one of my last webinars, so I thank you for that. And once I find that note, I will thank you personally. So what are we talking about today? Today we are discussing the amphetamines class of stimulants. Now, stimulants is a broad class of substances. Stimulants are basically, they speed up the body's central nervous system. It speeds up the metabolism, speeds up your heart rate, raises your blood pressure. It's an upper, basically. It gives you energy, it gives you a zing. The positives, like I said, include focus, include extra vigor, and elevated mood. However, with every good, there comes some bad, and the negative effects can include psychosis, paranoia, or insomnia. Now, stimulants include substances like caffeine, substances we talk about we see in our everyday life. Stimulants are everywhere. But really, today's presentation is going to focus on what I call the big three, and that is amphetamines, methamphetamines, and MDMA, which is ecstasy. Before we dive too deep into amphetamines, let's do a word on stimulants. So stimulants is an extremely wide range of substance. Like I said, there's caffeine in coffee or tea that you're drinking every day. All the other side of the coin on that is bath salts. So one thing we think of as relatively harmless, and we see it everywhere, and the other side, we see something that we think of as nothing good can come of bath salts. I think we could all agree on that. Now, it's important to know this too. Caffeine, while it is everywhere on our breakfast table every day, it's a deadly drug. If you took enough caffeine, you would die of an overdose. Now, really, every substance is harmful. It's really the dose that makes the poison. Too much water will kill somebody. So just keep that in mind. Just because we say something's relatively harmless doesn't mean it's not at some point deadly. So keep that in mind. And like the amphetamines we're going to be more specific about, you'll see that stimulants also have a wide range of therapeutic uses. But along with a wide range of therapeutic uses, we also see a big popularity increase for illicit uses. And unfortunately, they all are very highly addictive. Even the caffeine, if you've ever been a coffee drinker and then tried to stop cold turkey, you probably weren't a pleasant person to be around for a couple of days at least, not to mention your pretty major headache, I would imagine. So let's start with amphetamines. So amphetamines were discovered in 1887, and they were basically a synthetic answer to ephedrine. Ephedrine is a naturally occurring substance found in roots and herbs with names you probably haven't heard, names like joint pine or Mormon tea or Brigham tea. And these have been used for 1,000 years for medicinal purposes, whether it be upset stomach or lethargy or whatever, whatever was ailing them at the time. It had a wide range of therapeutic uses. Now, when we talk about amphetamines, we're talking typically about things we call speed. Um, you hear about names of speed like Black Beauties or Bennies or Crosses or Dexies. It was really, really very popular in the late 60s and the early 70s, especially as a prescription medication. It was, almost every household, I'm sure, somebody got a diet pill from their doctor that was basically Dexedrine, which is an amphetamine. So it was in everybody's medicine cabinet growing up. That was just amphetamines at the time. That was the way we looked at certain drugs at the time. Uh, Taking a step further, how much times have changed. One of the first pharmaceutical uses of amphetamine was a drug called Benzedrine, and it was given to the troops, both the Allied and the Axis troops in World War II. They're fighting a war. Everyone wants their soldiers to have the edge, to have the extra energy, to have the extra vigor, get out there and win the war. Eventually, they figured out how addictive it really was. And in the early 40s, I believe, before the war was over, they did stop giving it to the troops, although there was kind of we're just going to turn the other way while we know it's going on in the use. They didn't really lock it down too tightly, so it stayed very popular throughout the war. Now, amphetamines that you may have heard of these days, probably more than anything, is Adderall. Adderall is a medication for ADHD, attention deficit hyperactivity disorder, typically given to kids and other young people who are having trouble focusing. Remember, an amphetamine helps you focus on a single task. I get this question a lot about Ritalin. And if you were at my webinar, not the last one, but I think the one before, we talked about how Ritalin, while it has a very similar effect to Adderall, and it is still a stimulant, it is not an amphetamine. Remember, all amphetamines are stimulants, but not all stimulants are amphetamines. So it's kind of good to keep that piece of information separate from one another. So if you see something that has a stimulating effect, you're not necessarily expecting it to come up positive on the amphetamine panel on your drug test. Okay. Next, we'll talk about methamphetamines. Excuse me. Methamphetamines were discovered in 1893. Now, if you look at this chemical, the molecular diagram here, I'm going to go back a page and you can see the amphetamine molecular diagram. They're not so different. These are very similar drugs, really. They're very similar substances. What happens is, amphetamines becomes very popular and science wants to build a better mousetrap. They want to find a stimulant that has all the benefits of the amphetamines, but without all the negative effects. Well, obviously with the methamphetamines, they did not accomplish that. And we ended up with a drug commonly known as crystal meth that by all accounts is a much worse drug than just the amphetamines were. That was also used in World War II by both troops. It was really popular in the 60s. Late 60s, it was made mainly by biker gangs. Remember the Hells Angels? They were very big into manufacturing what they called crank at the time, like a bathtub version of crystal meth. And again, this is back in the late 60s. Well, fast forward today, and we have Mexican cartels with so much money. They have these huge, basically super labs, for lack of a better description. These labs would make a pharmaceutical company jealous. I mean, they're very high tech, very clean, all the newest equipment. Problem there is now we're seeing methamphetamine that's so much higher quality and so much less expensive that methamphetamine is on a huge uptick for use these days. And we talked about that during the last webinar. We saw how big that spike was and what the difference in price. Like amphetamine, of course, this is also a very highly addictive drug. The reason methamphetamine is typically thought of as that much worse, or one of the reasons I should say, is when we talk about amphetamines, we're typically talking about something that's a pill. All the names I gave you before, Black Beauties, Bennies, Crosses, those are all pills. Adderall is a pill. So taking a pill isn't as devastating, may not be the best word, but it's not as harsh on your body as the way most methamphetamines are ingested. It's typically either smoked or it is snorted or it is injected directly into your bloodstream. So these are huge mass doses hitting the body at once, and it is a lot for the body to recover from. It also feeds that addictive, chasing that initial feeling, that initial rush. With heroin, they call it chasing the dragon. They're just trying to get back to that first feeling that they ever had from their first methamphetamine. Also important to note, for us anyway, is that methamphetamine, as it's being purged from the body, will metabolize into amphetamine. So typically someone who has taken methamphetamine, we will expect to see a positive on both the amphetamine and the methamphetamine panels. All right, let's go on to MDMA. So MDMA is short for 3,4-methylene-dioxymethamphetamine. Kind of a mouthful there. But you'll notice the last few syllables is methamphetamine. Again, this isn't so chemically different than amphetamines or methamphetamines. MDMA is more colloquially known as ecstasy, sometimes called X or E. And then the new name we're hearing more than anything is probably Molly. Now, Molly, when that first came around, it was supposed to be a pure form of ecstasy, typically found in a powder form as opposed to printed in a pill, as you can see in that image there. But nowadays, we pretty much just hear Molly as being synonymous with ecstasy regardless. So ecstasy was discovered in 1912, and there's a few different versions of quote unquote ecstasy. We have the ecstasy that we see now, the MDMA. There was also MDEA, which was often referred to as Eve. And then we saw also around the 70s the MDA. Now, MDA, most notably, if anyone's ever seen the movie Studio 54, but the pills that they were selling at the disco were MDA. Basically, that was the love drug, the dance all night drug of the 70s and early 80s. It really got popular because in the 1970s, they tried to use it as a way to enhance psychotherapy. They thought it might have some benefits in treatment. So they did it in small doses. But of course, once something is released into the public's knowledge, then we end up seeing it as a street drug pretty quickly after that. It didn't really get hugely popular until probably the late 90s, when we saw it really associated with the rave culture. We saw people who wanted to dance all night to flashing lights and loud noises. So it became very popular with that group of folks. Now, before I make this next point, quick note on DEA drug scheduling. So the DEA creates what they call drug schedules. It's basically a ranking of how dangerous or how safe a drug is. To give you an idea, the safest rating is Schedule 5. And that includes drugs like Valium or codeine, like Tylenol 3, very low dosages of these drugs. We go all the way to Schedule 1, and it's things that have zero recognized medical use, things like LSD, things like heroin. Interestingly enough, both amphetamine and methamphetamine are Schedule 2 drugs. That means they do have acceptable medical uses. In fact, there are a couple of drugs in the United States still that we still prescribe in the US that are actual methamphetamines. Now, out of the three that we're talking about today, ecstasy is the only one that is a Schedule 1 drug, meaning no acceptable medical use and a high potential for harm, abuse, and addiction. Well, luckily, recently, the FDA has granted ecstasy what they call a breakthrough therapy designation. And what this does, it allows doctors and scientists to study in very, very tightly controlled situations using this drug for health benefits. Right now, they're using it to treat PTSD, and they're using it to treat depression. Those are the two main uses they're looking into it. So this breakthrough therapy designation has really done some good things. They're also they're looking into microdosing of psilocybin, which is magic mushrooms. They're looking into ketamine, which is a dissociative anesthetic. So they're using these kind of think outside the box drugs under this breakthrough therapy designation to see if we can find some medications that'll do important help for people. So it's good that they're allowed to at least experiment, and when it's this tightly controlled, you can be sure it's being done in a very safe manner, very consistent with science manner. So that's important too. So in summary, again, not every stimulant is an amphetamine, and not every amphetamine is a stimulant. All of them have potential therapeutic uses. but all of them also have high potential for abuse and addiction. Um, One quick note here, amphetamine and methamphetamine use is up, but MDMA use or ecstasy use is still staying relatively flat. So we're not seeing any major spikes in ecstasy use going on. So if that's one little positive amongst this whole doom and gloom that I just gave you, then take that one. Oh, I did miss one other fact I wanted to point out on the methamphetamine. I'm sorry, on the MDMA. The MDMA will break down your body to methamphetamine and then to amphetamine. So it is normal to see somebody who has taken MDMA trigger a positive on all three of the panels. All right, looks like we've got a couple questions up here, so I will get to those. First question from Wendy Dodge. Oral saliva test. If someone is positive for methamphetamine, will he or she also typically positive for amphetamine? Yes. Most of the metabolization in the body for methamphetamine and ecstasy takes place in the bloodstream while it's still while you're still under the effects of it. So typically you would get positives on both the methamphetamine and the amphetamine. Probably not the amphetamine for very long. And it's not going to be as reliably detected on that panel, or the body's not going to generate as much amphetamine to be detectable as much as the methamphetamine. So while you might get both, don't be surprised if you don't. I guess that's the better way to describe it. Next question from Ronald Williams. What if any cross reactions will cause amphetamine panel to have false positive? We have a patient that gets positives on it, but is swearing that he isn't taking anything illegal. Well, a couple of things on that. Number one, yes, there are some non-amphetamine things that can cause a positive on the amphetamine panel, usually ephedra or ephedrine or pseudoephedrine. So they're very, similar. Again, ephedrine was what science was going for when they created amphetamines in the first place. But then a lot of things people don't realize that they are actually taking a drug that's actually an amphetamine. Not a lot of people would know, even the people that are prescribed Adderall, that they're taking, an amphetamine. I have a friend of mine who gets shots of phentermine for weight loss and was surprised to be positive on an amphetamine panel. And I explained it. You're taking an amphetamine, so it's not that surprising. So yes, while amphetamine can have a false positive, it's more likely that whatever medication they're taking is just unknowingly an amphetamine. All right, looks like that's all the questions. Let me check the chats box in case somebody put it in there. Copies of the slides. All right, just so you guys know, I have all the chats that I can pull afterwards. So if you requested something in there, it will be seen and addressed. So I'll make sure I get that for you. And since there's no more questions, I'm going to let everyone get back to work. I appreciate you guys coming out. I really, really am glad that a lot of people seem to find these things useful. It's not the most entertaining subject matter all the time. I'm aware of that, but it is helpful, I think, and hopefully it does make your daily drug testing duties a little bit easier, or at least a little bit more insightful. We'll see you guys next time, and thank you very much.